My name is Matt Cordova. I'm a clinical psychologist. I am a psychologist at the VA, a staff psychologist in Northern California VA at the Martinez outpatient clinic, and I work in a part of psychology called behavioral medicine, which is psychology applied to medical conditions. I also am a professor at Palo Alto University, an associate professor there where I teach health psychology and work with students around traumatic stress. Clinically, what we see is that these patients are triggered to experience anxiety and avoidance specifically because of their cancer experience. So these are veterans in our case who have PTSD from combat or another trauma, and then those symptoms might get much worse when they're confronted with something that's threatening now, a life-threatening situation like cancer. And then a lot of the situations they face with cancer are very uncertain. The medical setting, the uncertainty of their diagnosis, some of the rigorous treatment, being in a confined space around a lot of people they don't know, those can kind of be button pushers that make their symptoms worse. One of the things that's a big stressor for veterans with PTSD who have a diagnosis of cancer is they're under threat, they're needing to make a lot of decisions, they're meeting a treatment team that they haven't worked with before and needing to develop trust and a working relationship with them. They're needing to make a lot of appointments and adhere to pretty complicated treatment sometimes, so those things can be a challenge. For physicians, I think, and other people who work in a cancer setting, I think from the other side, you're trying to build a trusting relationship with this patient, trying to reassure them, trying to transmit a bunch of information that sometimes requires them changing their behavior, being at appointments, eating a certain way, taking medication a certain way, and that can be challenging for them. Some veterans with PTSD who are having an exacerbation of symptoms due to their illness can be avoidant. They can kind of want to duck and cover and protect themselves by shutting down, withdrawing, and that can sometimes make it hard for the providers to communicate and to make good treatment decisions. There are practices that are probably good ideas no matter whether or not the person you're seeing has PTSD or not. They're good patient care for someone dealing with a medical illness, specifically cancer. But these are particularly important for physicians and other healthcare providers in a cancer setting when the veteran has PTSD. So one of the things I encourage is them to really focus on establishing safety and being emotionally and physically present. So sitting in a way, as opposed to having your arms crossed, standing up, having your legs crossed, focusing on the computer screen, instead to make eye contact with the veteran, sit in a way that kind of invites connection and openness and is reassuring. We encourage healthcare providers to be transparent in how they communicate, to explain what they're going to do and why they're making certain decisions, give some predictability to a pretty uncertain situation. We encourage them to tell the veteran what they're going to do when they're going to do it. So for instance, if they're going to get up and check their breathing or their heart rate, we'd encourage them to say, I'm going to stand up and use my stethoscope to listen to your heart or listen to your breathing, or I'm going to walk around behind you now. Those kinds of basic things can be disarming. Another thing we encourage physicians to do is to ask the veteran where they'd like to sit, whether or not they'd like the door open, whether or not they want a family member present to ask questions or document some of what's being told to them. Even asking veterans if they want to record part of the interaction so that they can remember some of the information. It's pretty hard for any patient to remember all the medical information being presented, but when you have PTSD, it's particularly hard if you're having trouble concentrating or if you're kind of perceiving or on the lookout for a threat. Sometimes that can make it hard to hold on to information. For mental health professionals is to recognize that just like other kinds of subtle triggers for veterans who have PTSD, we talk about a fear network, and we talk about the very extreme and rigid protective beliefs that people have when they have PTSD, that the world is dangerous, that you need to be careful about trusting people, that these same things are triggered by an experience of a life-threatening illness. So being diagnosed with and facing treatment for cancer can make veterans more anxious, more on guard, more hypervigilant, more desirous to avoid those perceived threats. And so kind of understanding cancer as another thing that can trigger an exacerbation of symptoms. One of the other things that we really talk about is how important it is to integrate mental health care, whether that's social work or psychology or both, in a present way in an oncology or hematology setting. So being in the clinic when the clinic is in operation, as opposed to only coming when a consult is sent, or only seeing people in a mental health setting. Instead, being present in the cancer clinic, and seeing people in the infusion suite, or wherever they are, and whether it's meeting them in the waiting room or meeting them in an exam room. Those are really important ways, because many of our patients are veterans who have cancer and pre-existing PTSD don't have the wherewithal to get to separate appointments. Having to go to a mental health appointment, if they already have that set up, is cumbersome. And if they don't have it already set up, the idea of now needing to go to a mental health clinic to meet someone can feel kind of pathologizing, as if they're having a crazy reaction to a pretty stressful situation for anybody. If you have those mental health providers present, social work, psychology, even psychiatry consult available in your clinic in an integrated way, that really makes it seamless, and the veteran doesn't have to be sent to someplace. They can instead have whole person care right there in the clinic. Well, it's interesting. I think that mental health providers who work with veterans who have PTSD, and mental health providers who are used to working in a medical setting, I think, and certainly nurses, and I would say all medical providers in the cancer clinic are probably familiar with what happens clinically. If you haven't had a lot of training in this area, you might not know why it's happening, but you may notice something's going on that makes it complicated. There's not a lot of research on this. So there's not a lot of research on people who have pre-existing PTSD and what it's like for them when they're diagnosed with cancer. And I think that, yeah, we are skimming the surface that way. We need to understand that better from a science perspective. This idea of multidisciplinary care and integrating mental health and medical care for veterans is just essential. This is a population that has a lot of overlapping issues, and that they deserve to be treated as a whole person, not just as a body.